This is a PowerPoint presentation on a journal article review. The article is Moving the Needle Toward a Data-Driven Healthcare System, Optimizing the EHR Through Information Governance by Sandra Kersten, MPH, RHIA. She was the Director of HIM Practice Excellence at the American Health Information Management Association. This article, the article was published in the Journal of Healthcare Compliance in May-June 2013 edition. The key points in this article were that for a company to be successful, it must recognize information as a valued asset. And also, for a company to be successful, it must have an information governance program. To go along with that, the information governance program must engage critical owners, such as clinical staff, legal staff, compliance, quality management staff, hospital information management staff, IT staff, finance staff, etc. It also must have ownership from the executive level. Additionally, it must have standardized internal definitions, plus a successful IG program would address accountability, priorities, policies, procedures, quality of the information, life cycle, security, privacy, data, and documentation standards. The article demonstrates these points by following Hawaii Pacific Health, or HPH, and how they went about optimizing the use of their EHR. Hawaii Pacific Health wanted to show the return on investment from its electronic health record system. The first thing the company focused on was just decreasing its cost to collect or improving its revenue cycle measure. To start working on this, HPH put together a team. The team was from various areas of the company: financial, information systems, patient safety, health information management, clinical staff, and also others from the front line, like registration and scheduling staff. Part of the problem the team had to work on was which data was critical to understanding and or solving the problem. From that question came the realization that a lack of standardized internal definitions was making it difficult to apply consistent measurement across the organization. Once the team worked out these issues, they were successful in finding the revenue cycle cost of collection indicator. From there, they expanded into the quality indicators, improving obstetric and pediatric care. Ultimately, HPH was able to use their EHR and other information systems to bring improvements to the population health of their care constituency. How did HPH make it happen? They made it a priority to get maximum value from its technology systems and the data. They recognized the value of the information as a key resource and asset in achieving quality of care, and used the data and its EHR to achieve improvements in its bottom line in the clinical quality of care. And Hawaii Pacific Health focused on improving its bottom line through its information assets. It focused on the information quality aspect of information governance, drilling into the data to determine what it really needed and how to get it accurately captured. Again, they valued it as an asset. They valued their information as an asset. They set a good structure of accountability for the information assets. They set priorities over the information systems and the data. They set policies and procedures to guide the appropriate use of data from the initial capture through retention or disposition. And they also addressed the information quality, information life cycle, the security and privacy of the information, and the data and documentation standards. The article asks, where does your organization fall in the information governance spectrum? And it makes some recommendations to the reader. It says the reader should ask these questions. When you try to get information or data to solve a problem, is there a clear way or place to get it, such as dashboards or current reports, etc.? Additionally, once you get the data, is the data in good shape? Is it ready to use, or does it need a lot of rework? When you get the data, does it seem that every data project requires cleanup of the data? Do one or more persons have responsibility for data quality, ensuring that the data is collected appropriately and consistently? The article makes some recommendations to the reader if their organization does not already have a program established. It recommends starting with executive leadership and gives several points on how to approach selling the subject to executives in your organization. Those points include selling the idea to obtain champions, start from anywhere. If you don't have an executive level support, work from the bottom up to make progress on your own. Develop strategic partnerships or alliances and expect to take at least 12 to 18 months to establish your program if you are starting from the beginning. The article concludes that an information governance program is critical for maximizing your EHR and other information systems to get accurate and actionable data that can help your organization achieve improvements in care and cost. Developing a program that engages critical owners, again, clinical, legal, compliance, HIM, IT, finance, etc., and has executive level champions will help ensure your success. Again, one of the key points, main points in this article was that a successful company must recognize information as a valued asset. Going along with this point, companies must recognize information as a valued asset. This is a valid point, and the concern that some companies do not realize this is backed up in other literature. For instance, Thornton May, in his article, "The Time is Now for Information Governance," stated, "The real value of information cannot be fully realized unless data is properly governed." And yet, in many organizations, information governance is amorphous, undefined concept. And the second main theme of this article was a successful company must have information governance program. must develop a good IG to handle that information. Which is backed up additionally by Thornton, supporting Kirsten's assertion that companies must develop good IG to handle that information, with the following statement: information governance is important high ground that must be mapped, monitored, and managed. Kirsten's other point throughout the article were such things as that there is standardized internal definitions, that there should be standardized internal definitions in order to apply consistent measurement across the organization. This is common sense and important in information governance. It is also pointed out by Gordon Hoke in his 2014 article, Top IG Tech Trends, Auto Classification, and Big Data, that part of IG success is overcoming the separation or isolation of the various departments like IT, finance, RIM, legal, research and development, accounting, sales, human resources, procurement, and others. And this is important in order to harvest synergies, according to Hoke. This only occurs when a company applies consistent measurement, and as Hoke points out, better coordination leads to less redundancy with better operations and compliance, creating better value to the organization because of information governance. The final point that Kirsten makes in her article is that good information governance program needs to address accountability, priorities, policies and procedures, quality of the information lifecycle, security, privacy, data, and documentation standards. And it is backed up in the textbook and other articles. One such article, Data Governance by Jane Griffin, in 2008 points out that any data governance effort begins with developing policies for data ownership, control, and stewardship. When clear policies are enforced, it's easy to tell where the buck stops relative to who or what the business unit owns and has stewardship responsibility for key data entities throughout the enterprise. Ownership and stewardship policies are usually augmented by formal corporate-wide data oversight processes and clearly defined data standards. Consequently, critical data is easily available in standardized format when it's needed. In this article, Kirsten helps us understand the importance of information governance in our own workplaces through the Hawaii Pacific Healthcare case. I feel this article has helped clarify information governance as it relates to any business. And if any business is unsure as to how information governance can help them, they can take a look at the Hawaii Pacific Healthcare case to give them a better understanding. And Kirsten's suggestions on how to approach the executives and how to go about it even if you don't have immediate buy-in are valuable information. And that concludes the journal review.